Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Encephalitis is a serious brain inflammation. It can be caused by viruses, bacteria, or other germs. This inflammation can cause problems with how our brain works. Encephalitis can be mild or severe, and it's important to seek medical attention if you suspect you might have it. Encephalitis is not as common as the flu, but it can be very dangerous. Anyone can get encephalitis, but young children and older adults are at a higher risk. It's crucial to be aware of the causes and symptoms to protect ourselves and our loved ones. The brain is a complex organ that controls everything we do. When it's inflamed, it can disrupt our thoughts, movements, and senses. Early detection and treatment are essential for a better outcome. We'll delve deeper into the causes, symptoms, diagnosis, and prevention of encephalitis in the following sections. Understanding this condition is the first step towards safeguarding our brain health. Viruses are the most common cause of encephalitis. These include common viruses like herpes simplex virus, which causes cold sores, and varicella zoster virus, which causes chickenpox and shingles. Other viruses like West Nile virus and mosquito-borne viruses can also lead to encephalitis. Bacteria can also cause encephalitis, although it's less common than viral encephalitis. Bacterial meningitis, an inflammation of the membranes surrounding the brain and spinal cord, can sometimes lead to encephalitis. Examples of bacteria that can cause this include Streptococcus pneumonia and Haemophilus influenzae. While less frequent, other causes of encephalitis include autoimmune disorders and certain medications. Autoimmune encephalitis happens when the body's immune system mistakenly attacks the brain, causing inflammation. It's not always easy to pinpoint the exact cause of encephalitis. Sometimes, despite testing, the cause remains unknown. This is referred to as idiopathic encephalitis. The symptoms of encephalitis can vary depending on the cause and severity of the inflammation. Some people may experience mild flu-like symptoms, while others develop severe neurological problems. It's crucial to recognize the warning signs and seek medical attention promptly. Common symptoms include fever, headache, and a stiff neck. These symptoms often mimic the flu, making early detection challenging. However, as encephalitis progresses, more specific symptoms may arise. These more specific symptoms can include confusion, disorientation, seizures, and changes in personality or behavior. In severe cases, encephalitis can lead to coma or even death. Therefore, any suspected case of encephalitis requires immediate medical attention. It's important to remember that not everyone with these symptoms has encephalitis. However, it's crucial to err on the side of caution and consult a medical professional for proper diagnosis and treatment. Section 4. Diagnosis and treatment. Diagnosing encephalitis involves a combination of physical examination, medical history assessment, and laboratory tests. Doctors will ask about your symptoms, travel history, and any recent illnesses. They will also perform a neurological exam to assess your brain function. Laboratory tests play a crucial role in confirming the diagnosis. These tests may include blood tests to check for infections, lumbar punctures, also known as spinal taps, to analyze cerebrospinal fluid, and imaging scans like MRI or CT scans to visualize the brain for inflammation. Treatment for encephalitis depends on the underlying cause. If a virus is identified, antiviral medications may be prescribed. Bacterial encephalitis is typically treated with antibiotics. In cases of autoimmune encephalitis, immunosuppressive drugs may be used to reduce brain inflammation. In addition to treating the underlying cause, supportive care is essential. This may involve hospitalization, intravenous fluids, medication to reduce fever and headache, and anti-seizure medications if needed. Section 5. Prevention and awareness. Preventing encephalitis involves taking steps to reduce your risk of exposure to the viruses and other germs that can cause it. This includes practicing good hygiene, such as frequent hand washing, avoiding close contact with sick individuals, and keeping vaccinations up to date. Vaccination is particularly important for preventing certain types of viral encephalitis. There are vaccines available for measles, mumps, rubella, chickenpox, and Japanese encephalitis, all of which can cause encephalitis. Protecting yourself from mosquito bites is crucial for preventing mosquito-borne encephalitis. This includes using insect repellent, wearing long sleeves and pants in mosquito-prone areas, and eliminating mosquito breeding grounds around your home. Encephalitis is a serious condition, but by understanding its causes, symptoms, and prevention methods, we can take proactive steps to protect ourselves and our loved ones. Remember, early detection and treatment are crucial for improving outcomes. If you experience any concerning symptoms, seek medical attention immediately. UMCC, your ultimate medical consultant connectors.